There's a fascinating new chart from the New York Times and the MIT Media Lab, and this compares COVID cases per 100 people, meaning per capita COVID, to how people voted in the 2020 presidential election. And the results are so simple that it's almost surprising. But then once you think about it, once you look at it, you realize actually it's not really that surprising. And the bottom line of the findings are as follows. If there are lots of Trump voters, there's lots of COVID right now over the last month. If there's a medium amount of Trump voters, there's a medium amount of COVID over the last month. And if there aren't that many Trump voters, there's really not that much COVID spreading either. So let's take a look at the image, and very, very nicely put together. So what you're seeing here are 5 separate lines which track new cases per 100,000. So the blue line means there are under 20% Trump voters in the county. This is a county by county thing. If you're not watching, I'm going to describe this to you. And then it goes from the blue line all the way up to the bright red line. That means more than 80% of a county has Trump voters. Now, remember that if you go back to the beginning before we knew much about COVID, early COVID hit the places with the big airports that are directly connected to Asia and Europe. And those are mostly in blue states. So early on at the start of the pandemic, and you look to the left side of the chart in April, you saw that it was blue counties with more COVID because we had this airport-based initial spread. You had New York City, you had Boston, Newark Airport over the water in Jersey, San Francisco, eventually LA, etc. Now, after a year and a half of the pandemic, having vaccines, understanding guidelines, you've essentially seen that since roughly August or September of 2020, it's been the red counties that on a per capita basis are leading the COVID case rates. The more red the county, the more they are leading in terms of cases, and that's not good. The lowest new case rates right now are in the counties with fewer than 20% of the population, less than 20% of the population, fewer than 20% Trump voters. Those are the places with the least COVID, followed by the places with 20 to 40% Trump. And then the places with 40 to 60% Trump voters have more COVID. And then the places with 60 to 80% Trump have more COVID. And the places over the last month with the highest per capita COVID case rates are the counties where more than 80% of the population voted for Donald Trump. And it's not by a small margin. If you look at those 20 or lower percent Trump counties, they only have 25 new cases per 100,000. If you look at the 80+% Trump counties, they have 65 new cases per 100,000. In other words, the big Trump counties have about 2.5, just shy of 3 times the new case rate than do the very Democratic leaning counties. It's truly incredible to see this translate perfectly into virus spread. Now, we expected this. Intuitively, we expected this, but the data shows it cleanly and clearly. Now, you might correctly say, this can't be good for winning elections, right? Like, in other words, if it's mostly your voters who are getting sick and overwhelmingly your voters that are going to the hospital and overwhelmingly your voters that are dying, that probably isn't good for winning elections, right? And you would be completely correct, except Republicans aren't actually trying to win by having more people who agree with them go out and vote. Republicans for a long time and recently and into the future are trying to win by planning to suppress the vote and making it harder for people unlikely to vote for them to actually be able to get a vote counted, not by winning people over on policy ideas. That being said, let's go back to the discussion that we had last week. Last week, we talked about how Florida's death toll now exceeds Ron DeSantis's margin of victory in 2018. Now, it's not relevant yet because that death toll includes children who don't vote, who weren't part of that margin of victory. It includes non-voting adults as well. And it's a mix of Republicans and Democrats. But it is absolutely plausible that over time, the partisan split in deaths, if it continues to shift to where it goes to being, 55% of the deaths are Republicans, 60% of the deaths are Republicans, 70%. Eventually, you could get a partisan gap such that you have enough more additional Republicans dying of COVID that it starts to impact elections. Now, sadly, we can't just look away and say to each their own, let them go and kill themselves, because vaccinated people still can get sick. Not everybody can get vaccinated. Vaccinated people could end up in the hospital. Vaccinated people could end up dying, in part thanks to the increased spread caused by the right-wing anti-vaccine people. But it's a very similar pattern to what we saw with the Spanish flu. Earlier, urban areas got hit harder. We saw that with COVID as well. More because of airports. It's unclear about the effect of the population density, but there may be one. But by the end of the day, by now, what we are seeing is that it's the most conservative areas, the most Trump voting areas, many of which are rural, that are getting hit the hardest. And it's two things. It's the lower rate of vaccination, and it's the higher rate of ignoring all of the guidelines that at this point we have a pretty good understanding of in terms of preventing COVID. So an unsurprising chart, but very informative in terms of it can feel vague. I don't know. We can't see the virus. I'm just with friends. This can't be a bad thing, or I didn't get a shot, but it translates to real world data. And we see it very clearly there. Not a factor here are religious beliefs, but the Republican governor of Mississippi, Tate Reeves, certainly seems to think that that is a factor. And I want to talk about that a little bit next.